So my name is Gaurov Dayal. I'm the Chief Medical Officer at Adventist Healthcare. As Jim mentioned, I'm also a pediatrician. Most recently, I was the Chief Medical Officer at Shady Grove Adventist Hospital. I'm very happy to be here and to be part of this, which sounds like a really exciting initiative by Rockville, by the city of Rockville. I think it's very appropriate that a talk on swine flu is being held at a pork barbecue place. As you all know, you can't get swine flu from eating pork, so there's nothing to worry about, but there is some irony in that. Because a lot of people get confused between the common cold, flu, pneumonia. So I think it's good to define what the flu is. Flu is caused by the influenza virus. It's a viral disease, which should be differentiated from a bacterial illness. Bacterial illnesses you can treat with antibiotics. Viral illnesses you cannot treat with antibiotics. Seasonal flu is a contagious infection of the nose, throat, and lungs, which is caused by the influenza virus. It pretty much happens like clockwork every single year, and it's a big cause of mortality in this country, actually, especially in the elderly. H1N1 H1N1 has been in the press a lot. It's the reason why H1N1 has been talked about so much is it's because it's a new form of the flu virus. It was first detected in the U.S. in 2009 April, and currently it's thought to be the predominant flu strain circulating in the United States. Luckily, there was a lot of media discussion about H1N1, especially before it came to the U.S. and when it was in China and other parts of Asia. But thankfully, the mortality and morbidity has not been too bad. Different type of flu viruses. Type A is what causes moderate to severe illness. This happens pretty much. This is our common strain of the flu. So actually, let me step back for a second. In very broadly speaking, there's seasonal flu, which happens all the time, every year. Most of you have probably gotten it. If you haven't gotten the flu, you've probably gotten flu shots. And there's an H1N1, which is a new sort of strain of flu. So let's just keep, and the talk is going to be going back and forth between the two of those. Just sort of separate those two strains. There's three different flu types. The most common is type A, which we see a lot every year. A lot of us get it. Type B, and also that happens in humans and other animals. Type B is mild. It only happens in humans and typically only in children. Type C is pretty much an animal virus, which we don't see in humans very often. For those of you, since this is Science Cafe, I thought I'd bring some deep, hardcore science slides, but some of you may know what a virus looks like. But this is a picture of the flu virus. On the left, the top actually is a true electron micrograph. So if you looked at a flu particle, you'd see the top left corner. On the bottom is a cartoon depiction. There's three components to a flu virus. There's the hemagglutinin protein. This is the part of the flu virus which, in yellow, which lets it stick, so to your nasal passage, to your throat, wherever. That's what sort of attaches to you. There's the neuraminidase protein, which helps sort of, I guess, it's like a syringe, which helps inject the flu particles into you. And finally, it's the genes which actually cause the infection. We use the word H and N a lot when we talk about flu, especially about H1N1. But to be honest, all flus are some sort of H and N. So going back to the previous slide, it's the two major components, which are the H and N. They're used to subtype the different influenza strains. There's 16 different H's, 9 different N's. And currently, the most common we're seeing is the H1N1 and the H3N2. Our own immunity can create antibodies to some of these particles, but not to all, hence the need to have a flu shot annually. So, and this comes up often, how come I got my measles shot when I was a toddler and I never had to get it again except for maybe a booster, or I got my tetanus shot 10 years ago and I'm fine. How come I have to get the flu shot every year? It's not the drug companies causing a conspiracy. There actually is science behind this. The flu shot the flu vaccine mutates every year because of these different components. So certain years you'll have H1N2, but the following year you'll have H2N1. So since things keep flipping, last year's immunity does not impart immunity on you for this year. I think most of us know this, but I think it's good to go over. How does the flu spread? H1N1 and flu and the regular seasonal flu spread the same way. Coughing, sneezing, and droplets. So basically, if you cough on somebody or often with parents, if you have a young child who goes to daycare and is touching another kid with the flu, they come home, you touch them, it's droplet. As I mentioned earlier, jokingly, especially in the swine flu case, eating poultry, eating meat does not cause the swine flu that we're seeing right now. So I think it's probably a good segue into what's the best way to prevent the flu. The best way to prevent the flu is good hand washing. Of course, there's vaccine, there's, in extreme cases, medication, but really the most common thing is good sanitary practices, staying away from people that are sick, people who are immunocompromised. By that I mean people who may have cancer, who are elderly or frail, or who have some immunodeficiency diseases such as HIV. They should stay away, even be more cautious from being in contact with somebody else with the flu, because they can get very sick with the flu. Common symptoms of the flu. This is actually, it's easy to read, but it's actually not that simple. As a physician, you'd be surprised, and you may have been in this position as yourself. You go to your doctor with these symptoms, and they're not able to diagnose that you have the flu, because there's a lot of overlap between flu, just the common cold, which is a much less serious illness and caused by a rhinovirus, which is a completely different virus, and things like pneumonia or strep throat. There's a lot of overlap. But what's sort of interesting about the flu is that there's never one isolated symptom. It's always a constellation of symptoms. You have to have fever. You can't have the fever without, if you have the flu, you have fever. If you don't have fever, you don't have flu. Typically, sore throat, stuffy nose, body aches, chill, and fatigue. What's interesting about H1N1, and especially for those of you either who work with children or who have young children, H1N1 was presenting as actually basically diarrhea and other stomach symptoms first, and then evolving into the other symptoms, which is very different than the seasonal flu. Even in adults, we've seen this where the first thing they got was diarrhea, stomach pains, and then later on developed other flu symptoms. We're not sure why that's the case, but it is. This is what we would worry about for emergency symptoms. So then there's your usual symptoms, but when should you go to the emergency room or call your doctor, or when are things considered an emergency? That would be if you're having difficulty breathing, shortness of breath, confusion, persistent vomiting, anything along those lines would be signs of an emergency. The other thing I would like to add is that if you have any underlying medical condition, so if you're diabetic, if you have heart disease, if you have any sort of lung disease, meaning if medicine in 1918 was very different. So one of the major causes of death with influenza is the flu virus itself doesn't kill you. It's what the virus leads to, meaning dehydration, or if you things like that really matter. And in the past, they couldn't treat that. If you were dehydrated, you can drink water, but that's pretty much it. So you have to keep in mind that it's not direct exposure to the flu necessarily that's causing these deaths, but lack of general medical knowledge and treatment back then. The Asian flu in 1957, a lot less severe, but still led to about 70,000 deaths in the US and 4 million worldwide. Hong Kong flu is the most recent till this one, and similar numbers. When we look at the WHO, they have pandemic alerts. That basically is where we are in the spectrum of things. Right now we're considered to be in phase 5 or 6 of a pandemic, meaning that there's for H1N1, which means there's widespread infection. The good thing has been that even though the spread of the H1N1 has been very significant, I have the numbers, I think 40 to 60 million Americans have gotten H1N1 flu. It's not been very serious, meaning a lot of people are getting flu, but not many people are getting seriously ill by the flu. So we're able to shake it off, for lack of better word.